All of the vaccines were rigorously tested for safety and effectiveness. And there were over 70,000 people that volunteered in the clinical trials for both the Pfizer vaccine and the Moderna vaccine to make sure that they were safe and effective. And at this point in time, we now have over 8 million Americans that have been vaccinated. So we've gone from tens of thousands to millions of individuals. The data is really, really, really exciting. Both of these products are 95% effective in preventing COVID-19. And what's even more important, or equally as important, I should say, is that so if something's 95% effective, that means 95 people out of every 100 that receive the vaccine, if and when they are exposed to COVID-19, they will not get sick. 5 out of those 100, if they're exposed to COVID-19, may get infected with the virus, but none of those 5 were hospitalized or died from COVID-19. So that is crucial. And there were no serious safety concerns in either of the clinical trials. And in fact, anything that was of concern was at equal rates between the placebo, and the placebo arm of a study is where you don't actually get the vaccine, you get like saline, or it's not of the real vaccine, and then you compare the two sides of the study. I know there has been information in the press about anaphylaxis, which is like a severe, potentially life-threatening allergic reaction. That is important to know. And what you need to do for your loved one or yourself is to look at the ingredients of each vaccine and make sure that you don't have a known allergy to either one of the ingredients in the vaccine. That being said, it's still extremely rare. The newest data say 11. You have 11 instances of a severe hypersensitivity reaction out of every 1 million people. Next slide, please. And one more thing, next slide, but the other thing to note is you do want to expect a few things after you get the vaccine. So for example, you're going to have a sore arm, and some percentage of people will likely might feel kind of tired the next day. They might even have a headache. They might even have a low-grade fever. That is actually good news. What that means is that your body is building its defenses against COVID-19. So that is a sign that the vaccine is working. It is not, so it's an encouraging sign. The other thing that's really important to mention is that there was a concerted effort in the development of both of these vaccines to make sure that individuals from historically marginalized populations were included in clinical trials. That is something we have not done a very good job of in the past. And in fact, to put it quite plainly, this is something that we've got in the scientific community has a lot to make up for. There have been some pretty horrible things, including the Tuskegee situation or experiment that was really utterly horrible. And so we've got some ground to make up, and we need to build back that trust. But that starts with individuals participating in clinical trials, and both in the Pfizer and the Moderna clinical trial. So for just as an example, African Americans were 10% of the Pfizer and 10% of Moderna, and they are 12, well, depending on which census data you use, it's about 12% of the US population. So it's not perfect, but we're getting closer to making sure that, and similar with the Latinx community. All right, next slide. This just reinforces the point that you cannot get the virus from taking the vaccine. With the way the vaccine works is it provides something called, you've heard of messenger RNA or mRNA, and that is simply the code to create a protein. Now that code, the messenger RNA, gets immediately degraded. So it'll make the protein and then it's gone. It doesn't stay there. There's nothing that stays in your system. Then the protein that it encodes is the spike protein, which is one of the proteins on the outside of the virus that allows the virus to enter your cells. So what happens here is in your body, but it doesn't encode the whole virus, so you can't get sick from it. It's just, it teaches your body to make that protein so that you can make tons of antibodies. So that when you get infected, when and if you get exposed to the virus, you have all that memory in your immune system. Your immune system is ready to go. And that's critical to not getting sick or not getting infected with the virus. Next slide, please. At this moment in time, 2 shots really are necessary. I know there's a lot in the press about, and there are some other countries considering only doing one injection. That's really not recommended. It is true, after your first shot, about 14 days after your first shot, you will have some immunity to the virus. How much, we don't really fully know, because that's not what we studied in the clinical trials. What was studied in the clinical trials were both shots. And so in order to get that 95% effectiveness, you need to get both shots. And that second shot will either be 3 weeks or 4 weeks after your first shot, depending on which product you got, whether it's the Pfizer or the Moderna. And again, the 2 products are equivalent. Next slide, please. North Carolina built a system called CVMS, or the COVID Vaccine Management System. And the cool thing about the system is it is programmed to do things like, for example, give you an automatic reminder when it's time for your second shot. And even though that it's able to do cool things like that, there is nothing about you that is recorded anywhere or that goes to the CDC, meaning none of your personal information goes outside of that system, so that everything is protected from a health information standpoint. Next slide. Again, we've mentioned that the supplies are limited at this point in time, and that we anticipate we're reaching more people every day. I think as of this morning, we were closer to like 220,000 individuals in North Carolina have been vaccinated, and that number jumps up quite a bit each day. The vaccines are free, as we've mentioned, and everyone does have a spot to get your shot. Next slide, please. And this is an infographic that's probably a little hard to read, honestly, but you can find it on the department's website. And this is sort of how the rollout of the vaccine at this moment in time is proceeding. And so you've heard a lot about phase 1A. Phase 1A is designed to make sure that we have a healthcare workforce that can take care of people that are critically ill with COVID. Because if any one of us gets sick with COVID-19, we want to make sure there is someone in that ICU or someone in that hospital that can take care of us. And then the rest of the prioritization is based on your risk of exposure to the disease, as well as your risk of either getting hospitalized or dying from the disease. And so the idea is to get it to the people. First, we're getting it to the people that take care of our sickest, because we've got to keep those that are sickest alive. And then we need to get it to people that are the most likely to have a bad outcome from COVID-19, and so on and so forth. Next slide, please. This is just sort of going through where we are. So right now, as I mentioned, phase 1A, it had to do with healthcare workers. The other piece that was in phase 1A are where we have seen the most deaths in North Carolina. So we've seen the most deaths in North Carolina in our skilled nursing facilities and our assisted living facilities. And so that is why long-term care staff and residents are also all part of 1A. And the federal government set up a partnership called the Long-Term Care Pharmacy Partnership with CVS and Walgreens. And so all of the skilled nursing facilities, for example, in North Carolina, had the opportunity to sign up with either CVS or Walgreens to come in to their facility and vaccinate all staff and residents that were willing. It wasn't just limited to skilled nursing facilities and assisted living facilities, just so that we're all aware, even though that's where we have the most death. Intermediate care facilities, or ICFs, and group homes, even if you're at like 6 beds or less, all fall into this 1A category. Now, there are facilities that did not sign up for the CVS and Walgreens program. And the names of those facilities have been given to the respective health departments. And so those health departments are working with those facilities to get their residents and staff vaccinated. And then obviously we know that last week on Wednesday, we started phase 1B, which initially begins with individuals that are 75 years and older. And again, that has to do with the death rate if you get infected with COVID-19 is dramatically higher for that age group. Each county, everyone's working as fast as they can, but each county is turning on the 1B as soon as they have sufficient supply. And then they are continuing to vaccinate anyone from 1A that they didn't get up to now, but adding 1B as we go forward. Next slide, please. And I think this might be where I hand it over to Tally.
Thanks, Carrie. And we're seeing all of the questions in the chat. Dr. Brown may review those, but we'll answer at least vocally at the end of this presentation. And I saw also the question around essential workers versus frontline workers and healthcare workers. So we'll return back to the phases at the end to go into a little more detail. On this slide, North Carolina receives shipments of COVID-19 vaccine each week. And there are also a lot of things happening both at the federal government level and the state level just to improve the delivery. There was just recent news, as recent as today, that I saw that the Trump administration is working to release more and not holding back as many for the second shot. As we've discussed, it's really essential that you get both the first and the second shot, and that protocol is followed. But there are tweaks along the way, which is, I have to say, not surprising, given the fact that this is all rolling out so quickly. The federal government decides how much COVID-19 vaccine each state gets based on the state's population. The department then determines which vaccine providers, like hospitals, local health departments, or clinics, will receive the vaccine doses based on their ability to reach prioritized populations. The manufacturers, Pfizer and Moderna, ship the vaccines and the vaccination supply kits to the local vaccine providers. So there's not like sort of a stop in necessarily at the state as much as going straight to where the state tells the feds where to send the vaccine or the manufacturers where to send the vaccine. North Carolina is working closely with providers to safely store and handle the vaccines. As we know, Pfizer especially has to have super cold temperatures. And vaccines will be available first in hospitals, local health departments, and long-term care facilities, and then in a variety of settings like clinics, pharmacies, and vaccine events in prioritized settings in the community. Next slide. So how do you find out where is your spot? So I put the link in the chat. You can also see the link at the very bottom right of this slide. yourspot.yourshot.nc.gov. yourspot.yourshot.nc.gov. There is also a phone number, a COVID-19 line at 1-877-490-6642, 1-877-490-6642. If you're a healthcare worker, you should talk with your employer about how to get vaccinated. If you're a long-term care staff member or resident, you should talk with your facility about how to get vaccinated. And we're going to get into more detail at the end of this about sort of who is a long-term care staff member or resident, and where other folks with intellectual and developmental disabilities fall in the various phases. For adults 75 or older, health departments and hospitals are beginning to offer vaccination appointments, as Dr. Brown just said. There will be a wait to receive your vaccine, but adults 75 and older will have some of the first spots to get their vaccine and should be reaching out to their health departments now. We hope that by early, and when I say their health departments, I mean the county health department in the counties in which they live. We hope by early 2021, health departments and hospitals will be doing this. Additional information on where to take your shot is available again at yourspot.yourshot.nc.gov. Next slide. We're working hard to keep North Carolinians informed so they can take their shot against COVID-19. I'm particularly proud of the IDD community for getting involved and getting information and then reacting to that information and doing some advocacy around these issues. We've had, there may be some participants who have attended more than one of these, but we've had at least 400 different participants who have signed up for the various webinars. We are also putting information, including some plain language information, on the NCCDD, let me say that again, NCCDD.org website, which is our website at the council. But the first and foremost place you want to go is the DHHS website and the Your Spot, Your Shot website that we've mentioned, and it's in the chat. Next slide. We know, as Dr. Brown said, that we have to lead with equity and we have to build trust. We know that racism runs throughout our social, economic, and healthcare systems, causing unequal access to care, maltreatment, and neglect for historically marginalized communities. These long-standing and continuing racial and ethnic injustices in our healthcare system contribute to a lack of trust in vaccines. Therefore, North Carolina is drawing upon the experience and expertise of leaders from these communities to develop and implement its vaccine plan. And I can tell you, because I go to these meetings, Dr. Brown goes to these meetings, that this is taken extremely seriously by the Department of Health and Human Services and by the state of North Carolina. And there is a lot of conversations with communities of color and historically marginalized communities to make sure that they are part of all of this process and that we're doing this as well as we can. Next slide. These are all the medical and professional organizations, and I encourage you to go to your professional health organization, the organizations that you trust, to see what they're saying about the vaccine, because this vaccine has been tested and this vaccine has proved effective and safe. And these organizations support you and your family members and your community getting the vaccine. Next slide. We want to emphasize that COVID, we're going to go back. Okay. Next slide. There it is. All right, these are all the resources that are being updated regularly that you can find on the website, yourspotyourshot.nc.gov. Next slide. Okay, this is an important slide, this next slide. This slide encourages you, and really, if you love your family members, if you love your community, please, please help us not slow and stop the spread of the virus, which means continuing to wear a mask. Even if some people in your family aren't wearing masks, wear a mask, practice social distancing. People are dying. The COVID has really spread throughout North Carolina and our country since Thanksgiving in very frightening ways. And we all, I think at this point, know people who have died because of COVID-19. So please, please continue to wear a mask and practice social distancing and practice the 3 W's. Next slide. So let's spread this information. Now that you've been here, please don't only just keep this information to yourself, but share the information you've learned today. And even consider, when you get your chance to take the vaccine, share on social media, let people know that you trust the vaccine, that you're taking the vaccine, and so that hopefully we can encourage everyone to do it. Next slide. So let's talk. Thank you for being here today. I'm really appreciative of Dr. Brown, who I can tell is already looking at some of these questions and has responded. But I'm gonna pause you, Dr. Brown, and go ahead and ask. And I'm sure that there's some questions I'll ask that you've already answered. But one of the big questions people are asking is if they have a specific diagnosis and IDD, how do they know when it is their turn? And I know that's a complicated question, but I'm going to ask David if you could go back to slide 11. And if you could just walk us through a little more in depth, just who in the IDD community gets it and where they get it, and what do you do if you have a condition that you're worried there may be some side effects that you need to take into account with respect to the vaccine?
So actually might answer your last question first, which is that there is the only absolute reason to not take the vaccine is if you are allergic to one of the listed ingredients of the vaccine. There is no medical condition that bars you from being eligible to take the vaccine. So if you have specific questions about whether the vaccine will be equally as effective for you because of having some certain chronic immune conditions or that sort of thing, then you would want to discuss that with your primary care doctor. But there's no medical condition that bars you from getting the vaccine. So the only thing that bars you from getting the vaccine is being allergic to a component of the vaccine. Similarly, there's no medications. Right now, there's no medications that keep you from getting the vaccine. So you can be on any medication that doesn't impact your ability to receive the vaccine. Individuals with IDD and their loved ones will get vaccinated in all of the phases, actually. So in 1A, we're going to see it where our individuals that live in immediate care facilities or live in any kind of congregate care setting, so our IDD group homes, for example, they will be vaccinated as part of 1A, and they will either be vaccinated by CVS and Walgreens through that partnership or through their local health department, because right now that's where the vaccine exists. Is the vaccines available at hospital systems and in the local health departments. Over time, as our supply gets bigger, we will have additional places that have vaccines. So for example, the next group are our federally qualified healthcare centers. So the FQHCs will be the next group to receive vaccine, and then eventually primary care doctors, and eventually your local pharmacy, et cetera, et cetera. So, and then in group 1B, there'll be lots of places that impacts the IDD community. So in group 1, that would primarily be, well, anyone that's 75 years or older. So it has nothing to do with the IDD or not having IDD, but if you're a caregiver that happens to be 75 or older, or your loved one happens to be 75 or older, any person in North Carolina that's 75 or older is eligible right now. And then in group 2 of phase 1B, are healthcare workers and frontline essential workers that are 50 years and older.
So we've had some questions about what is a healthcare worker and what is a frontline essential worker.
Yep. So the definition of both healthcare workers and frontline essential workers is actually pretty broad. And so for healthcare work, and details are on the department's website, on the COVID vaccine website. And actually, I believe the secretary is going to go through some additional details in regards to frontline essential workers this afternoon at a press conference in 30 minutes. So all your direct service providers, so if you, anyone that participates in home and community-based services, that's healthcare. Any behavioral health provider is a healthcare worker. I'm going to think of other examples of healthcare workers. If you, as a family member, are registered to do some caregiving of your loved one with special needs, that would count. Essentially, yeah, I think it's pretty broad. So every healthcare provider within the IDD system that's providing healthcare is eligible at some point in 1B. Now, if they're 50 and older, they get in group 2. But then in group 3 is any age. So, so for individuals that are living in their own home, which is great, that's the goal, right? We don't want people in congregate living. We want people to be able to live in their own home, that have direct service providers coming in. Those direct service providers can get vaccinated now if they're 50 or older, and then very shortly if they are younger than 50. And this is where I think it's helpful to have the DD community do their advocacy magic with employers. And so our providers of HCBS services across the state, as well, and all of our IDD providers, you really want to make sure that the employers are educating their staff about the importance of being vaccinated. And and are answering honestly and quickly any of their questions about the vaccine. Oh, I see a question that just popped up. Who do direct service providers get their authorization to get the vaccine from? Great question. So, their employer. So for example, if you have a company that provides home and community-based services, you as the employer provide a list of all of your employees to your local health department. Now, a lot of agencies are statewide. So what you do there is the company's, the county of the company's headquarters can provide the list to their local health department. And once those names are in the system, in the COVID vaccine management system, then those employees can go to any health department across the state and receive the vaccine, because it's essentially been preloaded and pre-approved in the system. Let's see, was that, no, wait, one more, hold on. So then now when we get to phase 2, and just for a sense of timeline, we'll you know, I think there's no exact date, but you know, it'll be pretty soon that we move from 1B to group 2 also. And so in phase 2, the first group is anyone that's 65 to 74. So, you know, we already got 75 and older. So now we're going to get anyone that's 65 and older. And then in group 2, this is where your medical conditions become relevant if you are young. So anyone that is age 16 to 64, so in phase 2, group 2, with one of the medical conditions that is known to put you at risk for complications from COVID. And for the DD community, the one that's maybe most applicable is Down syndrome. Then you are automatically eligible in that phase 2, group 2. The other common ones are if you have diabetes, if you have hypertension, if you have COPD, if you have obesity, and all of those are listed on the CDC website. And then let's see, and then in phase 3, we will be shortly we'll be able to do some. We were not quite to phase 3 yet, so we haven't done all the clarifications of phase 3. But for example, if an individual for some reason hasn't been caught in 1A, 1B, or phase 2, and they participate in day programming. So say they are in you know, whatever the different, there's a whole bunch of different day programs, that counts as the same as students. So that would also be phase 3. So and then phase 4 is sort of the catch-all. So does that answer the question, Tally?
Yeah, I think people are going to continue to have questions, but I think that was a really helpful answer. I think, you know, the question that I've heard in addition to that is just that individuals with IDD just interact with a lot of people because they may be at home and they may be using private pay as opposed to have a home and community-based services, or they may just be on the waiting list. But they have a lot more people coming in, or at least some people with intellectual and developmental disabilities need to have physical supports and other supports where they just have people interacting with them more than most people do. And can they qualify higher than phase 4?
Well, absolutely, right? Because remember, if you have a condition like Down syndrome, or you have obesity, or you have diabetes, right, then you're going to qualify in phase 2, group 2. Anyone that's coming into your home and providing caregiving, it could be private pay. They don't have to be part of HCBS. They're 1B, they're in 1B. So again, this is why of course, the staff bringing things, you know, we worry about staff bringing the virus into a home, right? So that staff is able to be vaccinated right now. And then if there's a reason to believe that you will have a poor outcome if you do get exposed to COVID-19, then you're prioritized based on that. And what we know is that outside of Down syndrome, and obesity and diabetes and, you know, all the listed, there's nothing that makes you more likely, and age makes you more likely to to have a bad outcome if you do get infected. I don't know if I'm saying that clearly enough, but like for example, autism, there's no reason to believe that if you have autism, you're going to have a worse course with COVID-19. Now, if you had autism and diabetes, absolutely, but it's because of the diabetes, not because of the autism. And same thing for medication. Oh, well, never mind, that's the same. Yeah, there's not, I'll leave it at that for now.
Thank you. We had a question about if you're pregnant, and also some questions about children. And so can you just talk a little bit about the vaccine and if you're pregnant or if you are under age 17 or even under age 18?
Yeah, so let's start with the kids first. So right now, if you're under 16, you cannot get vaccinated. There's no product that's approved for use if you are under the age of 16. If you are ages 16 or 17, you can get the Pfizer vaccine. The Pfizer vaccine has been authorized for use for individuals ages 16 and 17. The Moderna product, you have to be 18 in order to get it. Now, with time, that will likely drop. So for example, both Pfizer and Moderna are conducting clinical trials right now on children ages 12 to 16. And once that data is back, then then potentially there'll be a vaccine available for them. And then the other question about pregnancy. So, I think if you have questions, you should discuss it with your doctor, but you can receive the vaccine when you're pregnant. And in fact, we know that becoming infected with COVID-19 while you're pregnant, pregnancy can lead to worse outcomes for you being infected with the COVID-19. So individuals that are pregnant absolutely can get the vaccine that way. And then I saw someone wanted to say, breastfeeding. I could double check that. I don't see any reason why it would be impacted by breastfeeding. Because if you think about it, while breastfeeding, the only thing that you'd be transmitting to your child would potentially be antibodies to the virus. That'd be great. Then your kids might get antibodies before they could get vaccinated. But there's nothing, the vaccine it's just not how it's not like a medicine that comes out in your breast milk, if that is clear. And then someone asked me to repeat the thing about Down syndrome, and that is just that there is, so kudos to the CDC for being all inclusive and looking at all of the data. There's, and it's probably multifactorial, but it's probably related to some of the variety of genetic conditions that sort of go along with Down syndrome. But individuals with Down syndrome are known to die from COVID at a higher rate than the general population. And so that's why they, for example, are prioritized. Like individuals with diabetes are known to be more likely to die from COVID-19.
So, Carrie, I posted the CDC guidelines for medical conditions, but that link is still a little confusing because there's two groups that they talk about. They talk about adults who are at increased risk with COVID-19, and then adults who might be at increased risk. Can you talk a little bit about sort of who fits in to phase 2, group 2?
So that is a good question. So can you give an example of mine?
Sure. So at least I'll go ahead and explain it, and then Carrie, you can correct me if I'm wrong. So I put a link in, it's one of the last comments to the CDC guidance. And my understanding is that phase 2, group 2, and there may be an earlier one too, but specifically, individuals who have high-risk medical conditions who are between ages of 16 through 64 can qualify for the vaccine in phase 2, group 2. And so the explanation of which diagnoses fit within that, you go to this CDC document that I've linked, and there's two groups of people. There's a group that are listed as who are at increased risk, and there's a group that might be at increased risk, and it's the group that are at increased risk that are the ones that are included. And that includes people with cancer, chronic kidney disease, COPD, which is chronic obstructive pulmonary disease, Down syndrome, heart conditions, such as heart failure, coronary artery disease, or cardiomyopathies, immunocompromised state from solid organ transplant, obesity, severe obesity, pregnancy, sickle cell disease, smoking, and type 2 diabetes mellitus. I'm not going to say that right.
Mellitus, yep.
Thank you.
Got it. So that is actually a reasonable question for us to take back to the department. My understanding is at this moment, oh God, now I can't get back to you guys because I looked it up. Ah, where did you go? Oh, there you are. Okay. My understanding is that it is just that first group, as you said, the ones that are known to be at higher risk. But that may change. So I don't think we have a firm answer there.
Okay. Yeah. Thank you.
I know you can definitely count on it if you're in that first group, and we can get some clarification on if you're in that second group.
Thank you, Carrie. And this just shows, I mean, literally every week and sometimes more than once in a week, there's new guidance coming down from the federal government. There are decisions being made at the state, and that can be very frustrating. At the same time, it also shows that really intelligent people are really doing their best to try to think all of this through, that because the reality is there's just not enough shots right now, vaccines to go around. There will be. So it's really just a matter of making sure we get it to the folks who are at the highest risk the earliest. And these decisions are going to be difficult. I mean, some people are including within our community, the IDD community, are going to be frustrated, and there are lots of people within the IDD community who are advocating that everyone in the IDD community be vaccinated earlier. And you know, I encourage you, if you're interested in advocacy, to reach out to various advocacy organizations to see, you know, what they're doing about that. I'm wearing two hats today because we do advocacy at the council right now. I'm really sort of wearing my hat that's within the department of just sharing this information so that everyone in the community can make their decisions as to what they want to do. But I can tell you, everybody's working incredibly hard on this and takes this very seriously and is doing their best to make the right decisions.
I saw a couple other, one about whether you'll have to get will it be like the flu shot and you have to get it every year, which is an excellent, important question. We don't know the answer to that yet. So, you know, remember the clinical trials just finished a couple months ago. So we know that the immunity that you get from the vaccine we know for certain that it lasts several months. It probably is going to last much longer than that, but we have to run out the clock to be able to say that for certain. So I think we're all hopeful that it could last for years, for multiple years. I think we just don't have that answer. Scientifically, we don't have that answer yet. And then the other thing I saw somewhere in there is that it's really important to note that just because you've had COVID-19 does not mean that you should not get the vaccine. So even if you've had COVID-19 and you've recovered, you should still get the vaccine. And the reason for that is that people can get reinfected with COVID-19. Now, if you have been infected with COVID-19, it would be reasonable to wait 90 days because we know that within the first 90 days after you've recovered, you probably have pretty good immunity. So it would be reasonable if you wanted to wait 90 days, you don't have to, until you get the vaccine.
We had a question from one of our self-advocates. Does having IDD increase your risk of a negative COVID outcome if you get infected?
Not IDD per se. Down syndrome, yes.
Thanks. We've put in the chat where you can get a copy of this presentation, where you can go for the websites. We'll also be sending out an email soon. We've already drafted the email, but we've sent it to some folks at the Department of Health and Human Services just to make sure we're getting out as accurate of information as possible. But with some of the answers to some of these questions, we're also, as you heard, we recorded this and some of the other presentations. We're trying to get the information out as best we can. I've also been invited to speak a couple other places, and we're willing to continue to provide presentations. I really appreciate the dialogue and the questions and answers that have been shared. As Dr. Brown said, the Secretary is about to give a press conference, so there's going to be even some more updates coming very shortly. So I encourage you to continue to listen out for this information, get this information out. Please continue to wear a mask. Please get vaccinated when it's your turn. I think the last question I have for you, Dr. Brown, is around the county health departments and the LMEMCOs, and sort of where do you go locally to actually sort of sign up for the vaccine when it's your turn?
That's really, yes, it is well, right now it's your health department. And so each health department on their website should have information about how to, particularly if you're 75 and older, about how to get your appointment scheduled. I did see in the chat some an employer, it sounds like they're having some difficulty with their health department in terms of getting their employees uploaded. It may be that but keep pressing on that front, because the local health department, and we keep putting more and more information out there, including the department has regular communication with the health departments. But my understanding, and I will take that back, but my understanding is that any health department can upload a list of employees into the vaccine management system. And so it may be that that particular health department hasn't done it yet, and so needs some technical assistance. And there is a CVMS help desk that is available for individuals. And then, oh, someone asked if you needed proof. To my knowledge, you don't need, so we aren't in phase 2 group 2 yet, but to my knowledge, it's not like you'll have to have a note from your doctor saying that you have Down syndrome or saying that you have obesity, or saying, it'll be self-report. But we'll probably have more clarification when we get to that phase. But my understanding thus far is that you don't necessarily have to prove that. It's again self-report.
Thank you, Dr. Brown. I think this is a good place to stop this presentation, but there are going to be more presentations in days and weeks to come. I encourage you to reach out to the council if you specifically want us to provide another presentation. I'm sure we'll do it anyway, but if there's a group that you would like us to be presenting with, and I know, Dr. Brown, you're continuing to participate in presentations and educate the public. So I just, again, I mentioned this at the last webinar, Dr. Brown, but I think I made a joke because I wasn't taking the vaccine as seriously as I should. It was February, so it was a long time ago. But you and I were walking to a director's meeting, and you were very seriously corrected me, and I was serious ever since, because you made it clear to me that this was coming and that this was going to be as serious as it turned out to be. And I just appreciate your guidance. All I can plead is that I'm a lawyer and just don't know enough about the medical field, but I'm very grateful for you and for how seriously you've taken this virus since it was a real risk for our state and even before it came to North Carolina. So thank you for all that you're doing for the IDD community, and thank you for your presentation today.
Thanks, everyone.
All right, bye-bye,
I had something to ask. I have my hand up.
Grace Thayer has something to ask.
I'm
All right,
sorry.
Go ahead,
Thanks
Grace.
again. That's even more informative this time. But both my doctor and husband's and my daughter's doctor agreed that in that term on 1A, the third point, long-term care staff and residents, people in skilled nursing facilities, and adult family and group home. Well, she's an adult in our family with services, and her caregivers are going to get the vaccine soon. But when you don't really have, she was born with a rare genetic disorder, you don't really have a diagnosis like Down syndrome, but you know, for like 5 years, she has swallowing problems. So there's a suction machine beside her all the time because she can't cough it out or swallow right. And she's at risk for aspiration at any minute. We already lost another daughter with the same syndrome from aspiration of her own, you know, secretions. So, and 5 years ago, she had an ileus event that blew up her bowels and shrunk her lungs to like 2 inches. So she was on a vent for 9 days.
What I would recommend in that situation, I'm so sorry to interrupt, but since I know we have time and I want to make sure, I want to make sure that I answer. So what I would recommend in that situation is then when we get to the phase that where people are getting the vaccine based on their medical conditions, have your doctor write a note for you to bring to the department, right?
So that's group two.
Yeah,
group 2. Okay.
Right. So because just because you're not on the list, there, you know, there's always going to be one-offs. And so.
I'm fighting, like I'm fighting because she's going to get taken from this earth, hopefully before I am. But I don't want it to be from this. I don't want her to be alone.
Understood. Absolutely. You know, absolutely.
So, okay. Well, I thank you all for everything you're doing and everything. It's really informative. Thank you so much.
And thank you for standing up and asking your question before we left.
Well, that's fine. That's me.
I'm very grateful. So, all right. Well, thank you all so much.
If I could do anything to help to write letters or something, I know these phases are hard set and you don't have anything to do with it, but you know, some things should be moved, in my opinion. And
well, and I guess the other thing to be clear is that anyone that's caring for your daughter needs to get the vaccine now.
They got their appointments already.
Okay, good. That's because that's who's going to bring it to your daughter, right? So
well, or my 3-year-old grandson whose mother's a teacher and they won't close the schools right now.
Yeah, and I'll just take off my, Department of Health and Human Services and just wear my IDD hat. And, Grace, I think there are groups that are advocating that everyone in the IDD community, particularly because they have folks coming in. And, you're welcome to reach out to me. I can connect you with some of the folks who are doing that work.
I'm glad to help if I can too. Okay. Yep. Thank you so much.
All right. And thank you again, Dr. Brown.
Of course.
All right. Thank you, everyone.